Here's a post-surgery case. Now you're looking at before and after. Okay, this gal comes in. She could carry a bag of concrete across her yard, and she had a scoliosis, and she had years of pain. Did she ever go to a chiropractor? No. She went to the real doctor. It's cool. He uses Latin terms. Like, he won't say foot pain, he'll say metatarsalgia. So, it sounds like really cool. He won't say, headache, he'll say myofascial pain syndrome or something. They're really, really smart. So they put all this hardware in her on the left. And now, if we know, is the brain important? Yeah? Okay, is the brain always adapting to environmental stimuli? Yeah. Well, if you limit that brain's awareness of the body, it's going to start to send motor impulses down to get more awareness. So she started to develop this shake. Why? Because of lack of afferentation to her brain. And she started to not be able to sleep. Now, she's 74 years old, and you do a 3-foot-long cut in somebody, and of course, you got to chisel out some of the bones in the thoracic area because they move easier once you do a laminectomy on them. And then you put the bolts and screws in there, and they bolted her all the way up to the neck area. And one of the questions, because we have 7 questions that we pass out to find a corrective chiropractor, do you work on post-surgery cases? What other choice does she have? If you're not going to help her, she's done. And she asked me, she said, am I dying? And I said, if we don't solve the sleep issue, if we don't solve the bowel issue, if we don't reprogram the brain, if we don't get you out of this stress state, yes, you will die fast. Okay? And if we do, you got a chance at living. So she started, honest to goodness, started to get better. But she had limits. She started to shake. She started to do everything. And I'm looking and looking and looking. Have you ever sent someone back to a surgeon to remove some of the hardware? We sent her back. So this is the bag of hardware they removed out of this patient. It's like 3 pounds of metal. But of course, you can't leave her because you've already screwed up by removing the bones. You've done a laminectomy in the thoracic area, so you can't, there's no structural stability there. So they put in new bolts. Her shaking has decreased because of, better, proprioceptive responses. And she's getting a bit better. And I know you're excited because we got like 4 more bones that we could adjust. This is criminal. But then you look at the data points, there's no data that shows that that's based in science, that there's no data points to say this is accurate. So how do we change that conversation? We've got these patients that are in this homeostatic model, that the doctor is really, really smart, really, really educated. And they're educated with a philosophy that's completely dysfunctional. They're not given heroin to children. They're given a class 2 narcotic, amphetamines, to children. Oh, that's a really step up. Okay? When we look at this is a side view of her neck. You better be good at upper cervical. Okay? At least now we can start to get some more movement. But this is insane. And this isn't the only case. We could show you case after case, hundreds and hundreds of patients that have come in. They even got a billing code for it now. It's called failed back surgery syndrome. The surgery was successful, and the opioids that you're taking are just appropriately prescribed, and the muscle relaxants are working great. Of course, we're not going to look at any other adaptive responses you might have, and you're still hurting. It must be a syndrome. Couldn't possibly be our arrogant and ignorant approach to your body.